Hello, my name is Stephanie. I'll be your nurse today.
Hi, Stephanie.
Okay, so I'm just gonna ask you a few questions before the doctor comes in to see you. Is that okay?
Mm-hmm.
Okay. Can you give me your name and your date of birth, please?
Taylor Thomas, Taylor Thomas, 10/13/96.
Okay. And your phone number?
347-542-6626.
Okay. Birthplace?
Here, the Bronx. Well, yeah.
Your occupation?
Medical assistant at an urgent care.
And who's your employer?
What do you mean, like his name or?
Like the company that you work for.
SM Medical.
Okay. And the reason for your visit today?
A sore throat and body aches.
Okay. How long have you been having that for?
For about 2 days now.
Have you had any throat pain like that before, or is this the first time?
Usually I get it when I have like a seasonal cold.
Oh, okay.
Maybe like once a year.
Got it. So I'll let the doctor know that. Okay, so we're gonna discuss a little bit about your past health. Have you had any childhood illnesses?
No.
Any accidents or injuries?
No.
Any hospitalizations or surgeries?
No.
Okay. Do you have any children?
No.
Okay, so I'm going to ask you about your family history. Any of these diseases, just let me know, okay?
Mm-hmm.
Any history of heart disease?
Mm-hmm.
And that's on whose side?
Mom's side.
Which relative?
Mom.
High blood pressure?
Yeah.
Whose side?
Mom.
Stroke?
No.
Diabetes?
No.
Any blood disorders?
Sickle cell trait.
Sickle cell trait.
Anemia.
Okay, any breast cancers or cancers in the family?
No.
And we said the sickle cell trait. Arthritis?
My aunt.
On your mother's side?
Mm-hmm.
Any family allergies?
No. I get seasonal allergies.
Seasonal allergies. And any medication that you take for that?
Allegra.
Any history of asthma?
No.
Obesity?
No.
Alcoholism or drug addiction?
No.
Any mental illness, suicide?
No.
Okay, seizure disorder or kidney disease?
No.
Tuberculosis?
No.
Okay. Have you noticed any weight gain or any weight loss lately?
I noticed a little bit of weight loss over the span of maybe like 6 months.
Okay, how much weight would you say you've lost?
Like 10.
Have you been dieting or trying to lose weight, or?
No. Just maybe a little stressed out.
Okay, I'll let the doctor know. What is it that's stressing you? Is everything okay at home?
Yeah, everything is fine at home. It's just, life stressors.
Okay. Any skin changes, eczema, itching, or rashes?
I did have a rash on my side, but it was a little itchy.
Okay.
Not really though, just more so just dry.
And what did you do for that?
I used the antifungal.
Okay. How long has that been happening?
For like a week.
Is it still happening now?
No.
Okay. Any hair changes or changes in texture? Notice that you're losing any hair more than average? And your nails are okay? No changes? Do you wear glasses?
And contacts.
Oh. And when's the last time you've been to the eye doctor?
2 years ago.
2 years ago.
I usually go every 2 years.
Have you noticed any redness or swelling blind spots in the eyes? How about your ears? Any discharge or any pain? And your nose and your sinus? Any discharge, runny nose, nosebleeds?
No.
Okay. And your throat? You said you've been having
a little bit of soreness, a little bit of throat pain.
Okay. Any difficulty swallowing or any lesions you've noticed?
No lesions, but a little difficulty swallowing.
Okay. And your neck? Any pain? Change of limitation? Okay. How about your breast? Have you noticed any bumps or any changes in your breast?
No.
And your nipples are okay? No changes in coloration?
Yeah, they're fine.
And you know how to do a breast self-examination?
Yeah, I do almost every day.
Okay.
Every morning.
Okay, so let's talk a little bit more about yourself. Have you noticed any changes in your body, in your lungs, breathing, any emphysema or COPD?
No.
Any hypertension or coronary artery disease?
No. In me?
Yes.
No.
Have you noticed any coldness, numbness, or tingling in your arms or legs?
No.
How about your appetite? What would you say your diet is like?
My diet is fine. I eat pretty healthy. My mom eats a lot of fruit and salads and, grilled chicken, seafood, salmon,
Any abdominal pain or nausea or vomiting when you eat certain foods?
No. Maybe a little constipation when I eat food with iron or like fiber or too much fiber.
Okay. Have you noticed any pain with that or just
No,
soft
really.
stool, loose stool?
Just, I don't know how to explain it.
Do you say you go regularly?
Yes.
Okay. When was your last menstrual?
About a week ago.
Okay. Would you say that is normal? Any heavy bleeding or
No, normal.
any painful cramps?
No, not really. I get cramps, but they're not overbearing.
Okay. Are you currently in a relationship?
Yes.
Are you having sexual intercourse with any sexual partners?
Yes.
Male or female?
Male.
Okay. Any history of diseases or?
No.
Do you have any history of arthritis or deformity, limitation in the bones?
No.
Do you walk often? Are you physical?
Yeah. I'm
Exercise?
pretty active,
Okay,
A
that's
little
good.
something.
That's good. Any history of seizure disorder or stroke, fainting, or blackouts?
No. I fainted once, but I think I just didn't eat properly that day. That was a long time ago.
You have to eat. Eating is important. Okay.
It was a long time.
Any history of diabetes or thyroid disease?
No.
Have you noticed any excess sweating, tremors, or nervousness?
No.
Okay.
I think I have a little bit of anxiety problems sometimes.
A little
but
anxiety?
yeah,
What would make you say that?
It's hard to describe. I get like anxious. I don't know.
Is that something you'd like to talk to the doctor about?
No, not really. It doesn't bother me. I just know it just happens from time to time.
Okay. Okay, what was your last grade completed?
My last what?
Your last grade completed. Like how far in education? High school, college?
Some college.
Okay. And your occupation again?
Medical assistant.
Financial status?
What do you mean?
Like, do you have enough lifestyle? You have enough money to get food?
Yeah. Mhm.
And your value belief system? Like, do you have any faiths or practices that you do?
I'm Catholic, but I don't really go to church like that.
Okay. And self-care behaviors. What do you do to take care of yourself?
I shower, eat right, take care of myself, take care of my hair, take care of everything.
Okay.
I try to be a healthy person for myself and my family.
And what do you do in your free time?
Well, I usually go to the movies, I go out with my friends, I work, I sleep, I chill with my boyfriend. That's about it.
And how would you say your sleep pattern is? Are you think you're getting adequate amounts of sleep? How many?
I go to bed kind of late. I probably get about 6.5, 7 hours of sleep.
Per night?
Yeah.
Okay. Okay, can you tell me the last foods that you've eaten in the past 24 hours?
I had some vegetables, I had some potatoes, I had some beef, cereal, fruit, mac and cheese.
Okay, and who buys the food in your home?
Well, everybody. in my
And who
household.
prepares it?
Everybody.
Okay. Who's present at dinner times? Like, do you have family meals? Do you eat by yourself?
Sometimes we eat together, sometimes we eat alone.
Describe your role in your family.
Y'all just get personal, huh? Sorry. My role in the family. What do you mean?
Like, what do you do with your family? How is your typical day? Like, what do you do for your family?
I don't know.
Okay, would you say you have a close relationship with your
Yeah.
family?
Yeah.
Okay. And they're a good support system?
Mm-hmm.
How much time do you spend alone?
It depends on the day and how I'm feeling. But I mean, I spend almost equal amounts. Almost.
And how would you say you cope with stress? Like, what are some things you do when you feel uneasy?
I usually, study that stuff. I usually, I don't know, I'll sit in my room, listen to music, maybe a glass of wine.
Okay.
Real calm.
Are you an occasional drinker?
Yeah, I would say so.
How often do you say